I see something in through there.
Oh,
So the purpose of my speech today is to spread awareness and to teach everyone about monoamniotic twins. I am going to explain what monoamniotic twins are, the risks of monoamniotic twins, and how to reduce that risk. So what do you know about twins? You may know that some are identical and some are fraternal, when there are actually many different subcategories for those two kinds of twins, one of which is monoamniotic twins. I was compelled to learn about those twins when I was pregnant with them and would like to teach you about them today. So what are monoamniotic twins? According to Wikipedia and WebMD, it is when you have one sac and one placenta and two umbilical cords leading to two babies. Most twins have a separating membrane between the middle, so it's like one house and two rooms, but when you have monoamniotic twins, it's like they're sharing one room in one house. They are rare. They are only one in every 35 to 60,000 set of twins, and they are formed when the embryo splits 8 to 12 days after fertilization and after the placenta forms. Any later than that, and they would have been conjoined, which is not a good thing. That often leads to termination if they cannot be split up after birth. So what are the risks, you may be wondering? Well, they have less than a 50% chance of survival without medical intervention. They are at risk for cord entanglement, and 70% of monoamniotic twins suffer from cord entanglement sometime in the womb. Cord entanglement is when the fetuses move around a lot and tangle each other or themselves up in one or both cords. They're also at risk for cord compression, which can also happen from tangling the cords and the restriction of blood being cut off. When the restriction of blood is cut off from one cord, it is known as TTTS, which is twin-to-twin transfusion syndrome. According to the Twin-to-Twin Transfusion Syndrome Foundation, when the blood flow is cut off, so is the oxygen flow and the nutrients flow from what the mother eats. The umbilical cords are completely wrapped up and the blood cannot flow as easily to the babies. All monoamniotic twins are born prematurely and by C-section, sometime after viability, most of the time, which is 24 weeks. The date of viability is when a baby can live outside of the womb with medical help in an incubator in the neonatal intensive care unit with assistance from nurses and doctors around the clock. The March of Dimes says that premature births come with low birth weight, sometimes blood bleeds, lifelong disabilities, respiratory issues, cerebral palsy, vision issues, and behavioral problems. You may be wondering how some of these risks can be reduced. One of the ways to reduce the risk is not by continuing to see a regular OBGYN doctor who would normally deliver a baby and take care of you while pregnant. You would need to see instead an MFM, which is a maternal fetal medicine specialist. You will also need to see this person bi-weekly or once a week later on in your pregnancy to regularly have ultrasounds and monitor the baby's heart rates to make sure that there are no decelerations. Decelerations in heart rates mean that the heart rate slows down and the baby is suffering from some sort of either compression or entanglement. Another way to lower the risks is by fluid reduction, and that's when they stick a big needle into your stomach and take out the amniotic fluid so the babies can't move around as much to create as much entanglement. You can also have a twin reduction, which is usually recommended in triplet Momo pregnancies, which are even more rare, and that is essentially aborting one of the fetuses so there isn't as much movement and not as much compression in the cords. One of the best ways is by being injected with corticosteroids. because this will help the twins' lungs to grow quicker, just in case they are having to be delivered by emergency C-section after the date of viability. So their organs will develop quicker and they will hopefully spend less time in the neonatal unit. There was a study done by a fetal medicine specialist named Carlo Manguel in 2003, and he says that by using corticosteroids, it cuts lung disease in half and reduces the chance of premature deaths by 40%. Most women opt to go into inpatient surveillance at viability, which is basically fetal monitoring. You'll be strapped in a hospital bed where you will be living from sometime after viability, 24 weeks, and they will have heart monitors on your stomach to track the baby's heart rates to make sure there are no decelerations. If there are, you can have an emergency C-section, deliver the babies, and they can go to the NICU, the neonatal intensive care unit, and hopefully you'll make it to a planned C-section date, which will be no later than 34 weeks, because at 32 weeks, the risk of cord compression skyrockets, and you're risking the baby's lives even more, so anything after 34 weeks would be going too far. According to the Hayborn study, which is a huge study on monoamniotic twins, it's the biggest, it's very well known amongst the monoamniotic community, 14.8% of the cases studied, and they studied 88 cases, 14.8% that were not monitored did end up in fetal death. 0% out of the 88 that were monitored did not end in death. So being monitored is definitely the largest way to reduce your risk of fetal death or any other issues that may occur during a pregnancy for monoamniotic twins. Now that you know all of the risks and the ways to reduce the risks, you do also have to understand that a pregnancy like that can be very emotional, and it's very different than a lot of other pregnancies considering it's high risk. Sometimes termination is suggested by your OBGYN, which is why many people seek out a specialist. In my personal case, when I found out I was pregnant with monoamniotic twins, it was suggested to me that I should terminate the pregnancy. I immediately went and found a new doctor who helped me through the entire thing. I opted to do inpatient monitoring at 28 weeks, where I lived in the hospital until I had a planned C-section at 34 weeks, where I delivered two very healthy monoamniotic twins. They were 4 pounds each and only spent 3 weeks in the NICU, and I think that would be thanks to the corticosteroids that were mentioned before. I chose this topic to help inform you all about monoamniotic twins in case you happen to know someone who becomes pregnant with them and is scared. It's always nice to have a little bit of comfort. There are many support pages online, but now you also have the knowledge to share with them how to help your twins survive this risky pregnancy. Thank you.
Thank you.